Surprising numbers from a new study in the Journal of the American Medical Association. It suggests nearly 90% of adults over the age of 20 in the United States are at risk of developing heart disease at some point in their life. Joining us now to talk about that and some other health topics today is Dr. Jeff Pothof, UW Health's Chief Quality Officer. 90% of us, are at risk of developing heart disease at some point. Can you explain the science and really the data behind this stat?
Sure, absolutely. But yeah, 90% doesn't sound good. So basically, this is a scoring mechanism, the cardiovascular kidney metabolic syndrome group of things that come together. And you can score anywhere from 0 to 4 on this scale. 0 means you've got no risk factors for developing heart disease. You're good to go. Only 10% of people in this study of 10,000 people fell into that group. A score of 1 means that you're carrying too much adipose tissue. You're likely overweight or obese. Score of 2 would mean that you have some underlying conditions that we know can lead to heart disease in the future. That would be diabetes, chronic kidney disease, hypertension, maybe high cholesterol. If you're score of 3, that means you have subclinical or it's not bothering you, but you have heart disease. Then score 4 means you have heart disease. It's symptomatic. It's causing you trouble. And I think having 90% of people having a score of somewhere between 1 through 4 is a bit of an eye opener, really looking at, what are we doing as far as diet? What are we doing as far as exercise? Are we taking appropriate steps to decrease our risk of developing heart disease in the future with scores that are so high right now?
Because a lot of the factors that go into this it's not just genetics here, right? I mean, these are things that we're either doing or not doing that's setting us up for this risk factor.
Yeah, I mean, the good news, bad news is these are modifiable risk factors. There's things that we can do to prevent it. But with that said, it's hard, right? Like it's hard to exercise every day, even though we know it's good for us. It's hard to eat right. It's really convenient to buy food off the shelf. It's much harder to make a meal every night. So I get the internal struggle that people have. There's lots of data that says this is what we need to do to be healthy, to live long and fulfilling lives. And then there's the reality of it can be hard to do. These aren't easy things to do.
Very much so. All right, let's just keep this good news going here. A 30-year study shows that people should avoid anyways, 4 types of highly processed foods if they would like to extend their lifespan. And those 4 types of processed food are ready-to-eat meat, poultry, and seafood-based, speaking of convenience, right? Sugary drinks, dairy-based desserts, and highly processed breakfast foods. Does this mean that ice cream is a no-go here?
I mean, the truth here is everything in moderation. So when this study looked at it, it looked at the difference in all-cause mortality, so people who died, and how many servings of ultra-processed foods they have. And those in the high group would have 7 servings of ultra-processed foods per day. They had a 4% higher risk of mortality compared to those that had much less, 3 servings of ultra-processed foods per day. So it's not to say you can never have ice cream. It's not to say you can never have potato chips. It's not to say you can never have that really convenient, coconut chicken from Costco. But what it does say is that if your diet is predominantly those things, there's something about those ultra-processed foods that make it more likely that you'll likely have health complications in the future compared to eating unprocessed foods or minimally processed foods.
All things that we need to keep in mind and need to be reminded about consistently. Dr. Pothof, thanks.
Thank you.